Hi, Nusrat. How are you doing today? You're doing okay, but a little exhausted? Oh, you had to work all night. Yeah, it's really hard, I know. Just relax, okay? So, we're going to go over your health history and have you had any doctor visit recently or any changes to your medical history? No? Okay. So, that's good. So, you have no change in your health history and your ASA classification is 1. So, let's check your vitals and I'm going to check your blood pressure, pulse, and respiration, okay? So I'm going to check your blood pressure on the right hand and a little bit squishy and cold. Okay, your blood pressure is higher than normal, so I'm going to wait for 5 minutes and then I will check your blood pressure again, okay? After 5 minutes, let's check your blood pressure again, okay? A little bit squishy. Okay. Alright, your blood pressure is still higher. And I'm going to notify my faculty and we definitely need a note from your physician. Then I noticed that my patient is rubbing her chest and taking deep breath. Are you okay, Nusrat? Oh, you're having chest pain and feeling heavy on your chest and feeling nauseous. And I noticed that you are having sweating a lot. I think we may have something else going on here. Looking at your symptoms, I think you are having a myocardial infarction. So I'm going to stop all my dental procedures here immediately. And I'm going to give her nitroglycerin sublingually. Okay, so I'm going to wait a few minutes and then, are you feeling better now? No, it's getting worse. You're feeling pain on your neck, jaw, and shoulders, and you cannot breathe. Okay, it doesn't seem good. So I'm contacting code blue, and I'm going to call EMS. And I'm going to give you aspirin, okay? And as you said that you're having a hard time breathing, so I'm going to give you oxygen too. So she's having some oxygen and I gave her aspirin. And I'm putting my patient upright position and semi-supine position. And I'm activated her caps as CPR. I'm checking her pulse and the blood pressure and monitoring her vitals continuously. Okay. And in this period of time, I implemented the protocol for MI as she is showing symptoms of her MI and her pain lasted longer than 30 minutes and she's feeling more uncomfortable. So my protocol should be code blue that I did and call EMS and administer oxygen 4 to 6 liters per minute and monitoring her vital signs continuously, administered nitroglycerin 3 doses over 15 minutes period and 160 to 325 milligram of aspirin until the EMS arrived. So my patient is conscious. If my patient lost consciousness, that means she is going to have a cardiac arrest. That time I need to call 911 immediately and check her pulse. And if I don't have her pulse, then I'm going to start CPR with AED. If she gained her consciousness, still she needs to go to the hospital. Okay, I can hear the ambulance, the EMS arrived, and my patient is transferred to the hospital. So now I'm going to update her health history and changing her ASA classification 1 because she doesn't have any history of chest pain or myocardial infarction before, so she has ASA 1. But now she has symptoms of myocardial infarction, so I'm going to change her classifications ASA 1 to ASA 4 as she suffered the myocardial infarction, high blood pressure. So for her next visit, she needs to bring written permission from a medical provider and we need to see her at least 6 months after the suffering of the myocardial infarction, and we need to provide her stress reduction, oxygen supplement, pain control, sedation, and we have to reduce the length of her treatment time every time she comes to the dental visit. So I'm Shahana. Hope this video will provide a clear picture of how you can manage the dental emergencies of the myocardial infarction if it happens at the dental clinic. Thank you.